After placement of dental implants, do not disturb the wound. Avoid rinsing, spitting, or touching the wound on the day of surgery. There may be a metal healing abutment protruding through the gingival gum tissue. Sutures may have been placed. Do not disturb them. They are usually removed at the following post-op visit. Some bleeding or redness in the saliva is normal for 24 hours. Excessive bleeding, meaning your mouth fills rapidly with blood, can be controlled by biting on a moistened gauze pad placed directly on the bleeding wound for 30 to 45 minutes. Persistent bleeding may be controlled by biting on a moistened tea bag. If bleeding continues, please call our office for further instructions. Swelling is a normal occurrence after surgery. To minimize swelling, apply the ice pack or a plastic bag or towel filled with ice on the cheek in the area of surgery. Apply the ice continuously, 20 minutes on, 20 minutes off, as much as possible for the first 36 hours. You may switch to a warm compress afterwards. Drink plenty of fluids. Avoid hot liquids or food. Soft food and liquids should be eaten following surgery. Please refer to the nutrition after oral surgery insert for details. You may be instructed to continue with a soft diet for several days or longer depending on your situation. Return to a normal diet as soon as possible unless you've been directed otherwise. Unfortunately, some degree of discomfort is associated with oral surgery. You should begin taking pain medication as soon as you feel the local anesthetic wearing off. For moderate pain, 1 or 2 Tylenol or extra strength Tylenol may be taken every 4 to 6 hours. Ibuprofen, Advil, or Motrin, which is the same thing, may be taken instead of Tylenol. For more significant discomfort, the prescribed medications should be taken as directed. Be sure to take the prescribed antibiotics as directed to help prevent infection. Good oral hygiene is essential to good healing. Avoid toothbrushing the day of surgery. The day after surgery, the prescribed Peridex mouth rinse should be used twice daily after breakfast and before bed. Be sure to rinse for at least 30 seconds, then spit it out. Warm salt water rinses, a teaspoon of salt in a cup of warm water, should be used at least 4 to 5 times a day as well, especially after meals. Brushing your teeth can be started the next day. Avoid the surgical areas the first few days, then be gentle initially with brushing. Keep physical activities to a minimum immediately following surgery. If you're considering exercise, throbbing or bleeding may occur. If this occurs, you should discontinue exercising. Keep in mind that you're probably not taking normal nourishment. This may weaken you and further limit your ability to exercise. I may have told you to avoid wearing your partial denture, Essex retainer, flipper, or full dentures immediately after surgery and for up to 10 days afterwards. This was discussed in the preoperative consultation. Sometimes in aesthetic areas, the front, you may be asked to wear your Essex retainer but to remove them whilst eating. Please call the office to answer any questions you might have. I'm always available even after hours to answer your questions.